Polio is back. It's rearing its ugly head in Papua New Guinea. The World Health Organization just declared an outbreak. This is not a drill, people. 2 kids tested positive. That's too many. Even worse, the virus is lurking in the wastewater. This means it's spreading silently, unseen, deadly. Polio is a nightmare we thought we left behind. It can paralyze you, it can kill you, and it mostly targets the most vulnerable among us, children under 5. These kids deserve a fighting chance. They deserve a future free from this crippling disease. The worst part, this outbreak was entirely preventable. Polio vaccines are incredibly effective and they're safe. They're the reason polio was almost wiped off the face of the earth, but here we are again, staring down the barrel of a full-blown health crisis. Why? Because vaccination rates in Papua New Guinea are abysmal. We're talking less than 50% in some areas. Some districts have rates as low as 8%. That's not just irresponsible, it's a recipe for disaster. And now, that disaster is here. Papua New Guinea is a beautiful country with a rich culture and vibrant people. But it's also a nation grappling with poverty, limited healthcare access, and a severe lack of trust in vaccines. This toxic cocktail of challenges has created a perfect storm for polio to return with a vengeance. Misinformation about vaccines is rampant. Rumors spread like wildfire, fueled by fear and distrust of authority. Some communities believe vaccines are a Western plot to sterilize their children. Others fear the vaccines themselves are more dangerous than the diseases they prevent. This fear and misinformation are understandable given the history of exploitation and medical malpractice in many parts of the developing world. But the truth is, vaccines are one of the greatest public health achievements in human history. They've saved millions of lives and spared countless others from debilitating illnesses. The low vaccination rates in Papua New Guinea are not just a statistic. They represent real children at risk of contracting a horrific disease. They represent families facing the unimaginable pain of watching their children suffer. And they represent a collective failure to protect the most vulnerable members of society. The good news is it's not too late to stop this outbreak in its tracks. The Papua New Guinea government is scrambling to contain the virus. They've launched a massive vaccination campaign targeting all children under 5. That's roughly 3.5 million kids. They're aiming for 100% immunization by the end of the year. It's an ambitious goal. Some might even say it's impossible, but failure is not an option. Too much is at stake. The health and future of an entire generation are hanging in the balance. The government can't do this alone, though. They need help, and thankfully, they're getting it. The World Health Organization, UNICEF, and Australia have stepped up to provide critical support. They're working tirelessly to get vaccines to every corner of the country. They're also working with local leaders and community groups to combat misinformation and build trust in vaccines. It's a mammoth task, but it's a fight they cannot afford to lose. This outbreak is a stark reminder that polio is not just a problem for Papua New Guinea, it's a global threat. As long as even one child remains infected, the virus can easily spread across borders and oceans. We've already seen outbreaks in Pakistan and Afghanistan in recent years. The World Health Organization is warning of a potential outbreak in Gaza. This is a global wake-up call. We cannot afford to be complacent. We cannot let our guard down. The fight against polio is far from over. We need sustained global commitment and investment to ensure every child, everywhere, has access to life-saving vaccines. We need to strengthen healthcare systems, improve sanitation, and tackle the root causes of vaccine hesitancy. The resurgence of polio is a tragedy, but it's also an opportunity to learn from our mistakes, an opportunity to recommit to the fight for global health equity, an opportunity to build a future where no child has to live in fear of this crippling disease. Let's not waste it.